There is growing confusion after the CDC updated recommendations saying fully vaccinated Americans no longer need to wear masks indoors. The agency now says, despite the new guidelines, Americans should defer to local officials for rules on face coverings. Health experts are emphasizing the need to continue use in certain settings, and businesses are wondering, how can you tell if someone is vaccinated or not? Meanwhile, the pace of vaccinations is lagging here in the U.S. Of the more than 341 million doses delivered, only 268 million have been administered so far. But the country's infection rate is now at its lowest level in months. The nation is averaging fewer than 35,000 new cases per day, with the total case count since the start of the pandemic standing at more than 32 million. Meg Oliver leads off our coverage from New York City.
Tonight, mask excitement leading to mask confusion as states, schools, and businesses struggle with how to handle new CDC guidance that vaccinated Americans no longer need to wear masks inside or out.
It's definitely been a curveball. It's going to put us in a hard spot with how we're, number one, keeping our clients safe, our staff safe.
From baseball stadiums to beaches, no masks are required. Governors in at least a dozen states saying they'll immediately follow the new CDC guidance. South Carolina and Utah going even farther, dropping face coverings for all public school children, too. But in other cities and states, especially those that were hardest hit by the virus, there is caution tonight. New York, New Jersey, and California all saying mask mandates will remain for now.
If you're in a business or a public setting, we're not there yet. We're frankly not there yet.
From grocery stores to big box retailers, concerned that policy reversal could force workers to police who is vaccinated and who isn't.
When people come in and say they've been vaccinated, how do we know?
Major retailers, including Kroger, Starbucks, Target, and Home Depot, say they're keeping mask mandates in place. But Walmart and Trader Joe's announced masks are no longer required for customers who've gotten their shots, and stores won't be asking for proof.
There's no way for a business to know whether people are vaccinated or not. I think we're going to see a lot of big businesses go towards vaccine passports in order to keep their employees and their customers safe. But for others, they may just have to accept that risk.
The CDC says the decision is based on science and came after pivotal real-world data showing the Pfizer and Moderna vaccines were 94% effective in U.S. healthcare workers. But today, the CDC director acknowledged further guidance is needed.
What we need to do now at CDC and really across this nation is to take this guidance and revise our guidance. We need to look at our travel guidance. We need to look at our school guidance, our child care guidance, our camp guidance.
A new survey found that even in January, when COVID was at a peak, half of Americans were already not wearing masks when mixing with the public. Lana?
Interesting, Meg. Thank you. For more, let's bring in family medicine physician Dr. Brittani James. She is a co-founder of the Institute for Antiracism in Medicine and an assistant professor of clinical family medicine at the University of Illinois College of Medicine. Dr. James, thank you so much for being on the show. So let's get right into it. The CDC says more than 106 million people in the U.S. can now take off their masks. That's about 32% of the population. Do you believe that unvaccinated people will now be encouraged to get their shots as they see more people go maskless? Or do you worry that unvaccinated people will go maskless as well?
Well, we always hope that now people are seeing that this really is the way back to a normal society. The more people get vaccinated, the safer it is for them to go back to a normal way of life. And we're hoping by easing these restrictions that will kind of go on and encourage people to really step up and get this done.
But are you worried about the idea that not having these mask mandates in place anymore, that unvaccinated people will increasingly go maskless?
I think so. I think that's a normal thing to expect. And, the thing that I try to focus on is the science is showing that if you are vaccinated and you are around someone who, is unvaccinated, but they aren't wearing a mask, that you are protected. And that's really the most any of us can do. We can't control the actions of other people, but us being safe and being vaccinated, we see that we do have that layer of protection, and science is showing that. And so that's what the focus is. But I absolutely do think, to your question, that I'm sure people will see this as an opportunity to go maskless, even though they aren't vaccinated.
And Dr. James, the CDC says analysis of vaccinations among healthcare workers is what prompted the agency to ease its mask recommendation. What exactly did that data show?
Yeah, they tracked the data of healthcare providers who, of course, had the opportunity to get the vaccination first, tracked them at different sites over time, and we saw that the vaccines essentially worked. We saw similar results from some of the opening studies on the vaccine, and to test it in the real world is so reassuring. And the fact that we were also testing there for asymptomatic infections, and we did see that reduction and that protection of the vaccine from people even without from not showing symptoms. So this was just a resounding success, and the science is strong. These vaccines work.
The FDA said something very interesting. They say that children might not need booster shots as soon as adults will. Help us understand this.
Yeah, it's very tempting to think that kids are just little mini adults. But I think the important thing to realize is that kids have completely different immune systems. And that's why it's really important that we run specific trials separate from adults in kids. And so I'm not surprised to learn, and none of us are truly surprised to learn, that the physiology, the way the bodies work, are going to be different for kids. And so, of course, we want to give tailored recommendations depending on age group.
And the head of the CDC says that teachers and students can expect to return to in-person learning full-time in the fall. But not all kids, particularly younger ones, will in fact be vaccinated by then. So what are the risks? What should parents be concerned about? And what can reassure us?
Yes, I'm the parent of a young daughter. She is less than 2, and I certainly understand the concern. I think we all do the best we can, and when we think about protection, we think of what we call a Swiss cheese model. So, for certain populations, certain areas, making sure that we maintain that same social distancing. I know that we dropped to 3 feet in some locations now. Ventilation in our schools are important. People should take heart that the people who can get vaccinated should and hopefully will, but we have other protections in place to keep our kids safe. And most importantly, when we look at the evidence at the places where schools have opened, we don't see this sort of great surge in cases. And that hopefully gives peace of mind that when we try this in the real world, we are having success at keeping our kids safe, our most sensitive, a special population. So.
Well, with the last few moments that we have together, I want to ask you about what the head of the World Health Organization said recently, which is that wealthy nations should consider donating vaccines to low-income nations before administering them to children in their countries. What's your take on this?
It's for me, especially something that I think we can all learn from this pandemic, is just reinforcing this idea that we are a global community. Viruses don't respect borders. And I think as much that we can have the mentality that all of us have to work together to have joint protection to fight this horrible virus, I think that's a good attitude to have. I think we're in a position to help other countries. And when we think about the fact that to be a good global citizens mean that we reach out a hand to countries that need it. And I think it's quite important, not just from a humanitarian perspective, but because it can help us all move past this pandemic in a faster speed.
All right. Dr. Brittani James, thank you so much.
My pleasure.